Good afternoon, everyone. So, I'll be speaking on this is a case report on the sustained insulin independence in an elderly patient with a long-standing type 2 diabetes following an intensive lifestyle intervention, a 5-year follow-up case report. So we know that type 2 diabetes is highly prevalent in older adults, and also often it requires insulin therapy due to the progressive beta cell decline. Now again, if we see insulin use in elderly carries significant risks, making supportive treatment as a critical approach. Further, here we see like intensive lifestyle interventions show promise in managing type 2 diabetes, but the data on the long-term insulin discontinuation is in elderly insulin dependent patient remains limited. So the aim of this study is to demonstrate the sustained insulin discontinuation following an intensive lifestyle intervention in an elderly patient with a long-standing type 2 diabetes with evaluation of metabolic outcome over 5 years. So if you see the previous literature, we observed that prolonged insulin dependence is commonly regarded as irreversible. And also because of the therapeutic inertia, it often limits lifestyle-focused intervention. So a few reported cases of lifestyle intervention with extended follow-up, but the sustained reversal of more than 30 years insulin dependence is rarely documented. So the clinical relevance of this study is our study demonstrates feasibility in high-risk geriatric patients, and also it represents a safe non-pharmacological alternate or adjunct to insulin therapy. So the key message is to in long-term insulin independence in elderly type 2 diabetes remains rare, but yes, it is possible with personalized lifestyle modification. So in our study, the patient was 78-year-old male with more than 40 years of type 2 diabetes, and the patient was in insulin 40 units per day for more than 31 years. And also the metabolic profile shows that the patient SB1C was, when he joined our program, it was 7%, fasting blood glucose was 108, and the insulin sensitivity measured by quickie was 0.31. The patient also had comorbid conditions such as myocardial infarction, coronary artery bypass grafting, hyperthyroidism, hypertension, and hypercholesterolemia. And the medication which the patient he was in was regular human insulin, 8 unit per day, insulin human 50 by 50, 32 unit per day, and also in metformin 750 mg per day. And also he was in medication for comorbid condition, that is hypertension, hypothyroidism, and hypercholesterol. So the methodology which we employed was the intervention given to the patient was personalized, structure, and phase-wise. So dietary modification included a plant-based protocol, green smoothies, and balanced macronutrient. And also the dietary modification was adapted for his hypothyroidism and cardiovascular health condition. The exercise protocol, which consisted of three-phase exercise: yoga, walking, progressing to the light resistant training, and also he was given the structured weekly regimen of resistance, cardiovascular, and flexibility exercise. Stress management was taken care of through daily meditation, mindfulness, deep breathing, positive affirmation, and journaling were integrated for the emotional processing and stress relief. And there was a constant medical supervision for glucose monitoring via mobile app, which enabled physician guided medication adjustment for the patient. And also we follow safe de-prescription following the RSSDI guideline. And also the patient was given the micronutrient supplementation. So coming to the results, we observed that there was a complete cessation of 40 units of daily insulin therapy within 1 month of joining the program. And also the patient was able to maintain insulin-free status for 6+ years till the recent follow-up, but with a minimal oral medication. So till the recent follow-up, though the patient was free of insulin, but he was on the medication for gliclazide 60 mg twice daily, and he is also able to maintain the good glycemic control till the recent follow-up. So here we can also see that the patient was also able to maintain the sustained weight loss. The early weight loss of 9.4 kg was achieved within the 10 months, and he is also able to maintain this weight loss till the recent follow-up. Coming to the other metabolic changes, we also observed that there was there was an improvement in fasting blood glucose, fasting insulin, and insulin sensitivity index measured by Quickie. And we also further observed that the inflammation measured by hsCRP level was decreased. Lipid profile also improved, but he was still on the medication for the this lipidemia condition. So coming to the discussion, we can say that the sustained insulin decontinuation was achieved by the patient after the intensive lifestyle intervention, and also the patient was able to maintain this for 5 years of follow-up. And our study also this also highlight that there is a feasibility of insulin deprescription in selected elderly patient. Thus, we can say that though this study is limited to a single patient, but this case report it highlights that there is a potential of intensive lifestyle intervention and support in insulin deprescription in the elderly patient also. So, in our study, we attribute the key contributor to the success for the meaningful weight loss, which he achieved during the intervention period, and also improve insulin sensitivity. Further, we can say that insulin independence is possible in the selected elderly patient with long-standing type 2 diabetes, and also along with the medication, intensive lifestyle intervention may remain effective beyond early disease stage also. And our study has also shown that it is sustainable to be insulin free for longer duration. So basically the future direction will be to conduct this study, such study in a larger control study to develop evidence-based the prescription of the described in the protocol. So thank you.
Ms. Tiwari, this is more